Thank you, Dr. Nikki Stamp, for talking to the Op Report. Um, First question.
My pleasure.
You were
Mhm.
one of the early people involved in the "I Look Like a Surgeon" campaign, and I also see that you have a um, a blog online
Mhm.
that I've enjoyed
Mhm.
reading. Tell me,
Mhm.
I read a blog post about the B word. Please give me your
Mm.
perspective on how you're regarded differently from your male companions. For
Yeah.
example, in the blog, you had asked your operating team to arrive on time. Tell
Mhm.
tell me about that.
So I think it's a really common thing that there's this undercurrent of very subtle passive aggressive behavior to the way we perceive women, and I'm sure it's often unconscious. It's something that we probably learn from an early age. We're taught that girls are made of sugar and spice and all things nice, and the boys are, snails and puppy dog tails. It's something that it's quite ingrained within our society that we should be nice and accommodating, and certainly not be demanding or aggressive or assertive. So yeah, there's this very, very big pressure about what's acceptable behaviour by women, and I don't think it's something that's exclusive to medicine. There's a lot of stuff
Sure.
coming from management and business literature, and Forbes and Harvard Business Review publish a lot of stuff on this, that women are more likely to be called abrasive or bossy or
Bossy.
bolshy. Yeah, bossy, great word. I've been called bossy since I was very small, which is fair actually. But you don't want to be, and you don't want to be called those things. It's that very words with very strong negative connotations. There was a recent article, I think, in Forbes that showed that women were more likely to be given very negative feedback in their workplace-based assessments, with those sorts of adjectives being used. So there's this real pressure to conform to a feminine role and be accommodating and pleasant and sweetness and light, but also be masculine enough to make it in a male-dominated world. So yeah, I think it's something that a lot of my female colleagues have experienced as well. You have to be very nice. You can't have a bad day. You have to say, "Oh, sorry, if it's all right, can I have the scalpel now? Would that be okay?"
And in this
And even
particular
even
instance, did
yeah,
did it got back to you that someone?
yeah. I got called a bitch for asking my team to be on time, and that's not the first time, or probably won't be the last time, that someone will take exception with me asking for a certain behaviour or a clinical standard, or anything like that. It's kind of, it's a little bit disheartening, and makes you feel a little bit bad about asking people to do the right thing. Um, it makes for a hard day,
I'm sure.
but I know I'm not alone.
I'm sure. I'm sorry. I'm going to turn off this alarming phone. One second.
Yeah, no worries.
So I also saw something recently where there was an article about the hubbub in Australia about bullying and sexism in surgical training. So tell us about that. What's your perspective and your expectation for change and
Yeah.
in relation to that article?
Yeah, so I guess just as a bit of background, that all kicked off when a vascular surgeon, a female vascular surgeon, said that women would be better off giving into demands of sexual favours, essentially, from their seniors, because if you make a fuss, you'll have your training, your career start. And it was very, very controversial. It got into the lay media very quickly and was quite polarising at first. But essentially, what she has done is start off an investigation with the Royal Australasian College of Surgeons, where they got the expert advisory group, which were non-medicos, very distinguished and respected leaders from the community here, to lead an investigation into what exactly is going on. And what they've done is have various stages of data collection. It's all qualitative, of course, as to who has experienced bullying and or harassment during surgical training or after surgical training, who perpetrates it. And those results were quite shocking, that over half of surgeons at some stage in their career have experienced bullying or harassment. Mm-hmm. Women surgeons and overseas trained doctors were more likely to have experienced it. And then after they've sort of gathered that data, they went through a long process, a very robust process of trying to work out where to next, what to do. And so the final report was released, I think about a month ago now, into the bullying and harassment in surgery, and made a good deal of recommendations about where to from here. They're all very sound recommendations. There's recommendations to have some sort of independent investigator available if someone were to make a complaint. There's things like trying to change the culture of surgery, because I'm sure we all know it's a group of people who are very driven, and the way that surgery is still kind of an apprenticeship training, there's a very big power differential. So trying to change that culture, trying to improve the way we teach, so that we learn how to be good teachers, not just good surgeons, and hopefully that would give people some tools with which to manage trainees or manage difficult situations. So now that that's come out, it's actually been very well received, and it's sort of made it worldwide, which I think is fantastic, because the college here then has the opportunity to truly be a world leader in this matter. And there is starting to be a move towards, first of all, putting in place those recommendations. The college has got complaints hotlines and independent advice bureaus where people who are having difficulties can speak to someone completely independently of anybody that they work with, or is responsible for their training. So that's been a really great start. I think the other thing on a more informal basis is that report has certainly kicked off a lot more push towards role models that are diverse from our traditional notion of what a surgeon is. And it was just sort of fortunate timing that I look like a surgeon hashtag on Twitter, and these kinds of things have happened because we've got a group of diverse surgeons, women surgeons, who are very keen on leading the way and making a difference.
Nice. So those two purposes sort of coming together at the same time.
Yeah,
excellent.
Yeah, it's fantastic. Yeah, and I think it is going to, it is going to create change everywhere. The college, like I said, has led the way with this so far, but what we really need to do is get buy-in from everybody. So hospitals, for example, as our employers, are responsible for workplace bullying, and it's an occupational health and safety issue, and it's time now that everybody steps up and draws a line in the sand and says, no, we're not going to do this anymore. We need to provide a safe workplace for our doctors, nurses, and allied health professionals. And ultimately, that's going to be much, much better for the patients if you've got people who are happy to come to work.
Absolutely, and if they aren't concerned about challenging someone else on the staff.
Correct. Yeah, absolutely. I mean, aviation's a great example. If a mistake is made, in the past there was a certain hierarchy where the junior pilots would not challenge the captain, and mistakes have been made.
Yeah, they'd rather crash a plane than challenge the
correct. Yeah.
hierarchy.
Crazy. And there's a certain parallel with medicine there. We would sometimes rather crash ourselves than stand up and say what's right.
Right. So in one of your blog posts, you suggest that women are sometimes the worst enemy of other women in the workplace. Tell me about that.
I think that's changing, and I think social media has been fantastic with that. I've met more women surgeons in the last couple of months than I've met in my entire career. So that's been good, because you're getting a group of people who genuinely want to do good. But there is this sort of notion of pulling the ladder up behind you, so that if you've had to work hard and sacrifice and had a rough time, whatever your career is, but say during surgical training, that why make it easier for somebody else? And I think that's a particularly helpful attitude to have. It doesn't inspire people like you to join the profession. So I think that's one thing that we need to really put a stop to, and get a group of whatever minority, women or race, whatever, to come together and be supportive of one another and people coming through. And diversity is going to make a much better workforce. It's really, really important that we carry on with that.
Yeah, and you mentioned the number of women that you've met. I suspect you're talking about through the campaign, through the I Look Like a Surgeon movement, we should say.
Yeah, that's right. Yeah, I've met more women surgeons doing that. So in Australia, for example, there are 10 female cardiothoracic surgeons. So I know them all by name. So that's quite unusual. I've had very few female surgeons that I've worked for throughout training, mainly men. So, and yeah, it's like I say, in the last few months now, I've probably quadrupled that number.
Yeah. And what's the impact, do you think, of women finding other women and communicating? And
I just think it's just nice.
As you say, the various groups that, in other words, when people are seeing diversity and seeing people like themselves, what do you think is the impact?
I think it's validating. So it's very hard to sort of say I've had this particular problem and feel like, oh, it's me, I'm terrible, I'm awful, and it's not you. You're not alone. You're not the only person who've had particular difficulties through training, even clinical things. It's great to just have that support from other people. And I think the power of social media is incredible, and it makes you very visible for young women who might want to be a surgeon, or anything for that matter. I'd hope that this would reach far beyond medicine and encourage women to pursue anything that they thought they may not have been able to do because of gender limitations or any limitation. Really, it's got to sort of inspire a fire in the belly of anyone who would like to pursue something incredible.
Great. Yeah. Well, you've answered questions before I even got a chance to ask them. That's outstanding. So any last words about these topics?
No, I think it's wonderful that it's been taken up so readily by such a large portion of the surgical community and the wider community, and I'm really proud to be a part of it, and I hope that we're going to go on to do some fantastic things.
Thanks, Dr. Stamp, for taking the time to talk to the Op Report.
My pleasure.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.